Do you have spine pain or spine symptoms and the doctors use terms that you don't understand? Do you wish that you understood spine anatomy just a little bit more so that you could follow along? Well, that's what today is for. Hi, I'm Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation. I'm fellowship trained in primary spine care. And managing patients with spine symptoms is something that we've done for over 2 decades here. And helping them understand their anatomy is very critical in helping them understand what to do and what treatments to choose and which things to avoid. So before we jump in, please remember these videos are for informational and educational purposes only. They're not a substitute for medical or chiropractic advice, for diagnosis, for treatment. Seeing the wrong provider can result in an incomplete diagnosis, poor results, or sometimes no results. So let's jump into this topic. When it comes to spine anatomy, this is a 4-part series. The first one deals with the individual parts. The second one looks at the broader regions. The third one looks at the overall anatomy, the whole spine model. And last but not least, we finish off looking at normal function. So today we're going to be looking at the different regions. Now, in our last video, we talked about the individual pieces of the spine. You got a vertebral bone, you got a disc, got a bone underneath that, you got ligaments that hold it together, muscles attached to it to provide motion. So today we're going to look at all of these parts assembled into the different areas. I have another model for this. So with this model, we're looking at this from the side, and behind me, you got some posters that show kind of the same thing. So the spine is broken up into 4 regions. So you have the individual parts that we discussed before, but then you've got the region up here that you and I would call the neck. That's called the cervical spine. And here's the base of the skull that rests on that. So the cervical spine has got a lot of range of motion that it can attain. In the middle of the back, but not on my model here, is called the thoracic spine. Anything with a rib attached to it, a rib that makes up the rib cage, that's the thoracic spine. Down here, you've got the low back or lumbar spine. And then below that, you've got what sometimes is called the tailbone. That's also known as the sacrum. So you've got the cervical spine, thoracic spine, lumbar spine, and then the tailbone or sacrum. Now the sacrum, when we were born, these were individual bones, but then through adolescence, they're supposed to fuse together. So all of these regions help us understand how the body functions, and each one functions a little bit differently. Each one moves a little bit differently. So I'll show you some quick examples with the individual parts. This right here is in the cervical spine. This is the neck. If you take a look from a side view, the joints are at about a 45-degree angle. That makes it so that they can slip and slide and they can rotate really far. If you look here in the low back, these joints are angled more up and down. And so these joints resist rotation way more than the neck does. So these individual regions all have different purposes. They all work together as a unit. But when the doctor is talking to you about a thoracic problem or a lumbar problem, they're referring to different regions of the body. And each one has a different role to play in normal spinal motion, which is called spinal biomechanics. I hope you found this video helpful. I hope you found it informational. And I hope that it helps you on your journey forward as you try to understand your spine. You have many different videos to pick from. I am honored that you chose this one. And until we meet again, have a wonderful day.